And good morning, everyone. It's great to be with you at what is a very timely conference because it comes just days after Councillor Peter Johnston and myself launched our shared public health priorities and articulation of a shared endeavour to improve health and wellbeing. And today's gathering also precedes the publication of a suite of new public health strategies over the coming months. Now, and regardless of whether you're here today as a politician, a practitioner or planner, or you're a chief executive or frontline worker, what unites us is a desire to see the health of our nation improve. And the truth is, unless we work together, maximise the impact of what we do, blur and disregard boundaries, and work across the whole system with a determination to improve, then we won't make the impact that we need. Because while we have made some great progress, people are now living for longer than ever before, not everyone in Scotland enjoys the same health within our country, exhibiting significant and persistent health inequalities. That's not great for our communities, it's not great for our economy, it makes our services unsustainable, but far worse is that people's talent and potential remain unfulfilled and their happiness and their well-being are never fully enjoyed. The problems aren't new, but what we do have is an opportunity to do better because we owe it to the people that we serve and that we represent. It's what Campbell Christie challenged us to do in his report, that recommended services collaborate and be designed for people, that we act preventatively and tackle inequalities, and that we empower individuals and we empower our communities. And in a country the size of Scotland, we have no choice but to work together and to use our size as an advantage, be agile and responsive to change. Because if we get this right, difficult though it is, the prize will be a healthier Scotland now and also though for future generations. Inequalities and poor health don't need to be inevitable, and we have a chance to reverse some of the poor health that we have in our country. Now, health is often seen as the sole responsibility of the NHS. Our health service can do amazing things. It can care for us and it can often mend us when things go wrong. But the health service cannot create well-being, at least not by itself. The real levers for creating healthy people and healthy places, and many of the levers for effective prevention, are not found in hospitals and they're not found in ambulances. They lie with individuals, they are in our communities and in the work of the public service as a whole. And we've all seen how a lack of accessible transport can affect individuals in their day-to-day lives. We've all seen how poverty closes down access and opportunity. And we'll all have seen how the quality of spaces and the places that we live and the connectedness of our communities play a huge part in how people and how they feel and how they thrive. And to respond to these challenges, we need to be connected, we need to work collaboratively and imaginatively across the whole of society. The partnership between the Scottish Government and COSLA is the start of that, but we need now to accelerate and focus our efforts. And as I said, last Thursday, Councillor Johnston and I published our public health priorities for Scotland. And that document sets out a set of 6 cross-cutting and closely related issues where we must make progress. They are places and communities, the early years, mental well-being, the harms associated with alcohol, tobacco and other drugs, inclusive economy and opportunity, and diet, weight and physical activity. These priorities are deliberately not framed in the language of diseases and healthcare and clinical interventions. We have moved out of the medical paradigm to talk about the social conditions in Scotland. And there's no single organisation that can make progress on any one of these, let alone all of them. These issues sit right across the work of government, local government, the NHS, and the third sector, and many others. And we've developed and agreed the priorities through an open and collaborative process, and I'm reassured that there is broad consensus that these are the right things that we should be focusing on. And I know the priorities were informed by a review of the local outcome improvement plan, so the voice of localities is also at the heart of this. Now, the priorities have now been endorsed by a wide range of organisations and professional groups, including from parts of the system that we might not normally expect to see engaging in discussions about public health. This gives reassurance that our message about the broader efforts of society is being heard and that there is a willingness to contribute to this agenda. And we'll continue to build momentum on Scotland's public health priorities in the coming weeks and months, but we can start now to think about how we make more progress. I should also say that the priorities do not describe everything that we will do to improve and protect the health of the population, and will continue to deliver effective health protection services, including through the vital environmental health function. And of course, we need to be able to reflect local variation across Scotland, and that will continue to be the principle of our approach. And of course, the priorities are just a starting point. They're the first step in a long journey. We've also commenced work to reorganise the professional public health function in Scotland. And while our effort must be across the whole system, our specialists and professionals have a critical contribution to make in supporting, advising and informing that work. And in addressing the challenges of the present, we must also think about what we want public health to be in the future. Our professional function must be intelligence-led. It must use the best available information and exploit modern approaches to data. And our key assets, our expertise and our data must be deployable to support communities, localities and also local government. And that is also already happening in some ways through the LIST programme that supports integration authorities, but we want to do more of this. We have a wealth of data and expertise that can support you in the work that you do locally and regionally, and a reform programme is looking at ways to make that happen. And a key part of this is our work to establish a new national public health body. That new body will bring together our national assets and resources into a new single entity. The new body, Public Health Scotland, will have a role to provide expertise and support to localities, and it will have a meaningful accountability to local government as well as to the Scottish Government. We are agreed, I think, that we must build that to be a meaningfully different from the present. But that's not to say that what we have now doesn't work, but clearly we need to do more, and we must work in new and different ways to have the impact that we want. Public Health Scotland will be established in the second half of next year, and we'll still have some way to go, but the hard work has already started, and there is an energy and a sense of opportunity about what we're collectively trying to do. And our work to develop the priorities and our ongoing work around the national body has been a genuine partnership, and I think that's worth celebrating, that true partnership between local and national government. It's not always been the case, but I think certainly it's something we want to hold on to and build on. I think there's a great deal to celebrate in that partnership working. And in June last year, we established a high-level oversight board with responsibility for guiding progress against our commitments. That board includes local government and integration authority representatives, including Angela, on behalf of the local authority chief executives. And it's co-chaired by COSLA and the Scottish Government. And earlier this year, we established our formal programme board to take forward the detailed work of that reform. And again, this board is co-chaired by COSLA and the Scottish Government, and it includes membership drawn from across the system. And we also have appointed 2 directors to the programme to help drive the change that we need to see. Professor Marion Bain, recently Medical Director of National Services Scotland, and Evelyn McHugh, previously Chief Officer of Midlothian Integration Joint Board. And I think Marion and Evelyn are certainly here today, and I'm sure will be able to speak about the work that they are doing. But the reason for detailing those various groups and structures is important for 2 reasons. Firstly, that's to emphasise the point that we are genuinely working in partnership right across the programme, and that we are trying to embody the changes that we think we need to see in the system. And I hope COSLA share that view, and hope and agree that that is going well. Secondly, we want to give you a sense of the scale of the programme that is underway. A lot of effort and commitment is now supporting this process of reform. And colleagues across Scotland, including some of you in this room, are working on commissions to help us design the future. And momentum is building, but we certainly do need to do more. So I hope today is a place for you all to think about the role of local government in the reform programme, but also the role for local government in terms of improving health. You will each have your own views on this and on the challenges and opportunities these reforms might present, and today is a chance to air them and to share them. And while we do need to work in partnership, and there is strength in working in partnership, there is also some things that only each of us can deliver on our own. So in the coming months, I'll publish a number of specific strategies or policy documents aligned with the priorities on alcohol, diet and healthy weight, physical activity, substance misuse and tobacco control. In some cases, these documents will reflect a change in approach. In others, it will be a refresh and a reiteration of what we are currently trying to do. My role is to continue to ensure government and public services take these issues seriously, and that they are supported to do so. In recent months, I've also worked hard with my ministerial counterparts to build an awareness and an understanding about public health right across the whole of government. And that has led to some real tangible outcomes. For example, additional funding for active travel through transport colleagues and a willingness to think about public health in the context of planning developments. Now, I'm clear that all of government has a role to play in the same way that we want to see effort from across the wider system. For instance, as part of our commitment to community planning, we'll work with our communities to find the solutions to the issues that confront us. And if there are any activities across government where you think I can help you make progress in the context of public health, I'm happy to consider that and welcome any suggestions following today's discussions. So I think there's lots to be optimistic with our public health reforms and the prospect of groundbreaking collaboration between all parts of the system in Scotland. And I'm particularly optimistic about the partnership and the vision that we have developed with COSLA. But that optimism isn't just because it's convenient to talk about reform or because it's something that's nice for policy wonks to get excited about. I'm more optimistic about it because of what these reforms stand to deliver and the enthusiasm and the momentum I sense behind it, motivated by a desire to see an equal, fairer, more healthy Scotland. But we cannot succeed, though, without ensuring communities and people feel empowered, that they are listened to, that they're engaged with, and they don't simply have stuff done to them. That's why we launched the priorities document at the Ripple in Restalriggs, a third sector community hub where, with a bit of trust and with a bit of enablement, the community are finding solutions to their own challenges. And so in order to see all of our communities flourish and blossom, we need to trust them and we need to trust one another on this reform journey. I think Angela put it well when she talked about maybe needing to cede some ground ourselves because we win even if I lose. I think that's how you summed it. I think you summed it up really well in those words. So we all, in truth, I think, want to achieve the same things, a country that aspires to be the best place to grow up in, to live in, to work in, and to grow old in, and works hard to make that vision become a reality. So please enjoy the conference. I look certainly forward to working with you on that journey, and I look forward to working with you to make and achieve the outcomes that I think we all want to see happening across the country. It is an exciting time. I think there's lots of momentum building, and I look forward for this not being the start and end point of the journey, but actually continuing that dialogue to work right across the country with you to make all of these priorities become a reality and have the impact that our communities deserve. So thank you, and I look forward to hearing your thoughts through the rest of the day. Thank you.